Welcome to my channel Brainies. In today's video, I'm going to talk about the 10-meter walk test. The 10-meter walk test is a very simple and common test which is used to assess the functional mobility and gait. To perform this test, a person walks a straight line and a stopwatch is used to time their speed over a specific 10-meter section, and usually we ignore the first and last 2 meters for acceleration and deceleration. The walking speed is calculated by dividing the 10 meter by the time taken, and usually it is used in the clinical settings to evaluate the person's general health and also to track the progress during rehabilitation. Indications for this 10-meter test: it includes the neurological conditions like stroke, multiple sclerosis, Parkinson's disease, and spinal cord injury. And geriatric patients are also included in general, hip fractures, and lower limb amputations. Method of application: the participant or the patient is instructed to walk a total of 14 meters in each walk, including the 2-meter initiation and the 2-meter termination phases. So setup is, we usually set in such a way that a 14-meter clear pathway is marked with the additional markers at the 2-meter and 12-meter marks. The person begins to walk at a comfortable pace, and the therapist is instructed to walk at least half a step behind the patient. A stopwatch starts when the leading foot crosses the 2-meter mark, and it stops when the leading foot crosses the 12-meter mark. So this is a picture depicting the 2-meter walk test. You could see the distance here. The timer starts when it is 2 meter and it stops when it is at approximately 12 meter exactly. And the method of application is, the walking speed is calculated by dividing the 10-meter distance by the time in seconds. Sometimes usually we take the 6-meter central portion also is used for calculation. In that case, we divide the 6 meters by the time taken to walk that distance. If a person is using an assistive devices, it need not be ignored. It can be taken into account, and they can use that assistive devices. Repetitions, at least minimum 3 repetitions are used, and average of that is taken for results. So what the test usually measures here is, it measures the gait speed, the functional mobility of the patient, and the health status. Scoring: the total time taken to ambulate the 10 meter is recorded when the timing starts when the patient crosses the 2-meter mark, and the timer stops when the toes crosses the 12-meter mark. The 10 meter is then divided by the total time taken to complete. The total timing is recorded in meter per second. The inference: in case of stroke populations, that is in stroke patients, the speed less than 0.4 meter per second, it indicates an household ambulation. And in case of 0.4 to 0.8 meter per second, it indicates limited community ambulation, and greater than 0.8 meter per second indicates a better community ambulation. And in case of the fall risk in older adults, the walking speeds less than 0.7 meter per second, it is associated with increased risk of falls and dependence. The 8 specific values are as follows. The comfortable walking speed actually declines with age. The mean speeds for men is approximately 1.26 meter per second in 70s and 0.97 meter per second in their 80s or 90s. In case the mean speeds for women, it is 1.13 meter per second in 70s and 0.94 meter per second in their 80s or 90s. That's it with today's video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.